Today, I bring to you the journey of an aspiring dental innovator, how he made his path, his dream to prototype. I welcome Dr. Abhishek Bhadranna, consultant oral pathologist at Dr. Bhadranna's Oral Pathology and Hong. Dr. Abhishek holds a postgraduate degree in oral pathology and microbiology with keen interest in oral cancer and oral potentially malignant disorders. He is currently the chief clinician and partner at Adis Dentalay's multi-speciality oral and dental clinic where he is practicing general dentistry. He is a consultant oral pathologist where he provides histopathological reporting and research assistance in terms of laboratory support. He also holds the position of director and co-founder of 91 Danta Research and Product Limited.
A very good evening to everybody. I once again welcome you to an aspiring episode of Eclectica, the different news. I use aspiring because, as you can see, I already have my guest who is an aspiring and very young and innovative entrepreneur right here with me in the studio. So I welcome you, Dr. Abhishek, and thank you so much for being on my show and accepting my invitation for Eclectica. It's a pleasure to have you here today.
Yeah, good evening, everybody. And first of all, thank you, Dr. Gandhi, for considering me and giving me an opportunity to present myself in your channel. It's an honor. Thank you.
Okay, so I think Dr. Abhishek, you have been trained as an oral pathologist and you have been practicing for a quite long time now. So there are certain questions that runs in my mind, or also I think many people can relate to it. Like when it comes to oral cavity pathology as such, like whatever the dental issues we have and its management. So what is your opinion, or what do you think is the actual role of an oral pathologist in managing any oral cavity pathology or like oral disease? Yeah.
Yeah. So the practice of oral pathology, as such, in a commercial way, uh, you have few and people who do that. But in my experience, whenever I have seen, and when an oral pathologist is involved in the biopsy, the outcome is little better. So what happens when you send a biopsy to a general pathologist? Most of the times, the clinical information uh, is not completely given, and what happens with general pathology is they are exposed to few lesions, but a person general pathology who reports day in and day out of head and neck pathology and works with oral surgeon would make a difference. But an oral pathology, with his 5 years of BDS training, as well as working with different surgeons during his post graduation, he can actually throw light. Like for an example, if there is a frictional keratosis, you can see a keratosis lesion over there, and sometimes if it is biopsied and given to a general pathology, it will be given as hyperplastic keratotic epithelium. But if we look at, as we're going to ask what happened, where is the location, when we discuss that with oral surgeons or clinicians, we can actually give a direction to that. This one saying that it's frictional keratosis, nothing need to be done. We need to see how's the tooth in occlusion. So those things, those minor points that are added on by the oral pathologist with clinical correlation is very, very important. So I feel oral pathology is a person who has that clinical exposure, uh, work with his colleagues and give a meaningful diagnosis. Sometimes there is a diagnosis like a non-specific infection, most of the times whenever, but when you look at it, when we see the gingiva, we'll see that a gingival biopsy has been given. Then we're going to go back and take the history. There is some drug history involved there. So if we have that thing with us, then definitely we can contribute. The thing with your oral pathologists are closer to the oral cavity than a general pathologist. So I feel the management strategies are far superior when an oral pathology is involved in the team. When an oral surgeon or oral medicine person wants to treat a person with pathologies in his mouth.
Thank you for that wonderful, insightful answer. And I think I completely agree with you. I think oral pathologists are trained in a way that they look more closely, they know how to look more closely into at least a oral lesion per se. So I think that's really makes sense. So like the way you said, like so what I understand that this gives a notion of that when we are treating or even we are diagnosing a disease, it is a good thing that we work in a multidisciplinary way or interdisciplinary way. So from that context, I would like to ask you my next question, which is something like that. I think when it comes to oral pathologies or oral diseases, many a times surgical intervention is required. So the role of a oral and maxillofacial surgeon comes. I mean, I'm sure you are a better person to judge that. But then, I have seen that there is a lot of gap in this area where we do not find a common ecosystem where a oral pathologist or a surgeon together working. So, do you think this is important? First thing. Second thing, that if so, then why an oral and maxillofacial surgeon should work with an oral pathologist closely? Because I think your insights would really help people to understand these aspects.
Wonderful question. The thing, what happens with oral cavity is there is a constant interaction with the environment. Either
Right.
we have antigens in form of food, you
Mm.
have carcinogens in form of tobacco, and a lot of it is a dynamic environment.
Correct.
So there is a thing that oral pathologists ask a lot of questions as to when a biopsy comes from where the site was taken, how's the patient's oral hygiene, or is the same lesion there on the other side of the buccal mucosa. So there are a lot of things an oral pathologist asks. Sometimes oral surgeons feel that a general pathologist magically gives a diagnosis without much of information given to him. But what happens is there are situations when it is pathognomic. The picture on the slide is shouting out the diagnosis, but sometimes it doesn't. So
Mm.
that time it's really important. Sometimes there is a huge lesion intraosseously, and we have got only the superficial bit,
Mm.
and we are not able to say anything that is there. So if there is a lack of trust, and we say there is not enough tissue, and it goes back, the surgeon will always be disappointed. I believe me, intraosseous biopsies are difficult to take. It takes
Mm.
a lot of clinical skill and experience to take it out from the right region. And sometimes in a cystic lesion, the surgeon goes right into the center and gets something out. There, if it's a lesion filled up with uh, what to say, with, gelatinous material or a cheesy material like an
Right.
OTC, we don't get the actual pathology. We get the part of it. So
Mm.
again, we fall short of that, saying that this is a but. So if a surgeon, I work with surgeons, and we say, uh, this is the biopsies we are doing tomorrow. We are suspecting this, doctor.
Mm.
So if they're suspecting a carcinoma, I say, doctor, do a deeper biopsy. Go towards the muscle layer and give me a deeper biopsy. Now the surgeon, the suspecting or a clinician is suspecting a vesiculobular lesion. If you
Mm.
give me a biopsy of the ulcer, I'll not be able to say anything. I would
Correct.
say take it out from the adjacent normal mucosa, then there will be something. And I will ask for a wider biopsy whenever there is an autoimmune lesion. So
Mm.
this closeness with and trust of closeness where the pathologist also advises the surgeon, and the surgeon says, doctor, I've taken out from 3 4 directions, let me know which side I need to go. And the surgeon also says that he says that this person is flying out tomorrow, I need this faster diagnosis.
Mm.
So all those things, communication will happen when you are working closely with an organ. If
Correct.
you just give a biopsy to the patient and say go give it to this XYZ lab, and you don't know which pathologist is reporting over there, so it will be lost. The patient management and the patient running around will be far less if the surgeon and the pathologist, from the biopsy being done before that stage, they sit and discuss and then go ahead and do it. I have seen surgeons who think like pathologists doing really well. So I feel that the trust factor and working closely is the most important thing for the patient end result.
Fantastic. Yes, I completely agree with you. And I think the way you explain, like this is a very good thing for the patient as well, because as you rightly said that otherwise that person has to run around because if you as a pathologist you just cannot give just any diagnosis just by seeing something on the slide. So again, redoing the whole stuff is a whole lot of process. So I think there's a very good point that you brought this up, and thank you for that, and thank you that you work in this way. This is so nice. This is really nice. So when it comes to oral cavities, always it is an exciting ecosystem for me when I see it as a kind of it gives me a notion of a natural interdisciplinary ecosystem, because we have soft tissues like our mucosa, gingiva. We have the microbiomes hiding and floating over there. We also have the hard tissues like enamel. So from that point, I have a very interesting question to ask you. Basically, I'm interested to know more about your new endeavor and your company, that is Dr. Bhadranna's Oral Pathology and Co. So, can you tell us more about the kind of quality research in oral cavity, including the hard tissue like enamel and mucosa, and how your organization or your company is, actually taking part, and how exactly you are spreading out the word and the work on quality research. So that would be very interesting to know.
Yeah, this thing is always what to say, and any research uh, makes me like a curious person. Like, and I have that. Let me give some idea or contribute to that to that space. So there is a lacune where uh, people go to the laboratories and ask for different services that they can do. This oral pathology and core was established or started with this in mind, that one is histopathology reporting will do, and also provide services for these studies where I can connect them to the right laboratory technician or the right way to do the study and take it forward. So, for example, I did work with one of the PhD students where we had to check the amount of a connective tissue marker seen in the epithelium and a epithelial marker that can be seen. He was working on something called as the epithelial mesenchymal transition. So we did a lot of reading, and I saw that we can actually separate the epithelium out from the connective tissue over a tissue block. So in that way, we could study the epithelium separately and connective tissue separately. So these are the small things. These are cutting edge technologies that are there in abroad, but with our Indian Jugaad, we can do this very simply. So that's where Dr. Bhadranna's oral pathology comes in with some ideas and suggestions. And also, sometimes when I'm working with other people, we tend to meet people and their laboratory and their consultancy services. If the purview is not in my scope, I cannot give their services. I connect those researchers to the right people, and they will help them out in carrying out the research. So, and also, there was a research of toothbrush and microbiology of that area, how it improves or the colony counts decreases. So we sit and study with few articles saying we can do the split mouth technique with a electric brush this side. So that consultancy or that ideation that happens, and post that, how we can transport the stuff. So we came up with an idea that we have these Milton hot cases, right? For tiffin box. So if
Yeah.
we have to buy the whole freezer and transport these saliva from one lab to another lab, it becomes so expensive. So
Correct.
with the 3-4 hours gap, we used the gels, frozen gels, and arranged in that Milton like a
Yeah.
wall. And center you have those test tubes and locked in. We could send it over. So those small things that we can do it in a budget and also help the researcher as well as the person who wants to do it. It's in that space we come. So it's a nascent, it's a new beginning for us. So in that process, I also met you. So in that sense, Dr. Bhadranna's oral pathology and co. can help in contributing to oral research.
Fantastic. I mean, you are doing a great work. So, what I understand that your center or your organization are into two things. One is the typical or the reporting, histopathological reporting, and you are also providing research consultancy services. If may I put it, is that correct?
Laboratory support to them,
Hmm.
and not much of research consultancy, just work in the sense, but laboratory support definitely, yes. To
Great.
an extent, consultancy also, you can say, just a ideation level. Yeah.
Okay, okay. I think this is very useful, at least particularly for beginners, particularly for students, like you said that you work with PhD students or even postgraduate students, because they really need a hand holding for all this stuff. So I think it's a real good thing that you are doing. So,
Okay.
well, when it comes to oral pathology, the first pathology that shines up in anybody's mind is oral cancer. So my
Yeah.
next question would be regarding the same thing. So, how would you highlight, or can you tell us more about oral rehabilitation of patients undergoing cancer treatment? Because this is an area which a lot of things are happening, but I think if you can simplify and tell us more about it, it will be
Yeah.
very useful information.
So I feel there is a huge vacuum in that space where the quality of life of not only oral cancer patient, any cancer patient who undergoing radiation and chemotherapy, the first thing that gets affected is their saliva. Then the oral cavity becomes acidic. They develop these candidiasis. Then there are these radiation caries that happens. So with this involved, and already they are facing the trauma of the surgery and the trauma of the diagnosis. With this, it becomes an added inability or disability for the patient to consume that food that they have to consume for that healing. And also, even drinking of water, talking becomes so challenging for them. So, oral mucositis and radiation caries are all huge challenges if taken, if dentists are involved during the treatment and post treatment for the rehabilitation of their oral cavities. It's a huge add on to their quality of life. The patients fare far better, they'll feel better. Psychologically, they're more better because they have the oral cavity to have that kind of food and comfort them. So, rehabilitation post chemotherapy, radiation, and surgical one would be a different. A prosthodontist will come over there and rehab the missing structure. Along with this, the treatment of oral mucositis and other complication that occurs in oral cavity becomes very, very important. So there are many hospitals that do cancer surgeries, but if you look at that, they do not involve a dental dentist or a person who is specialized in dental rehabilitation in oncology. So it is a huge gap that the Dental Council of India also can think to add it in the curriculum so that the dentist becomes equipped, so that a dentist can go to a cancer hospital, say that he can contribute to the patient's health for treating their oral mucositis. And an oncologist also, dentists, if they are involved with oncologist, like example, before radiation, the whole oral cavity, which and all tooth are there that needs to be extracted, that are in poor shape, if there is radiation and the patient suffers after that, there is a contraindication for the next 6 months not to do any sort of extraction. There is risk of osteomyelitis. So these knowledge that we can impart as dentists and contribute to their quality of life, it is immense actually. In that sense, there is a gap, and uh, we are working and
That is very interesting to know. And well, but I am more interested to know about something that you have recently. It just came to my notice, and we also talked before this interview session when we interacted. So, if it is in your permissible periphery, then tell us more about little bit about your new innovation and your one step ahead, forming a company and becoming an entrepreneur in the space of healthcare, and what is your vision with everything. So I mean, it's very inspiring to see people like you, because I think you set an example for others, and you motivate others to come and follow your path. So really, I would like to know more about that.
Thank you so much, ma'am. And so they say no necessity is the mother of invention. So dentistry, yeah, I do have a dental practice. I do practice my oral pathology, but
Right.
uh, when uh, I had gone to a forum where we meet a lot of other business owners. So
Correct.
I would always see that a particular industrialist will have another vertical office.
Mhm.
After some years, he has another vertical where he has that cash flow coming into his space.
True.
So it was always the thing that why not? Uh, I'm a dentist. I have my clinic. If there is another vertical where I can contribute in terms of coming out with some products that is useful for dentists. If you
Right.
look at the population of India, there are going to be bound to be more dentists who's going to come, and there are going to be more dental clinics that's going to stem in. So if you have some innovative products
Hmm.
which are useful, definitely there is a space for you to grow there. So in that sense, during COVID-19, there was a huge challenge of controlling aerosols
Yes.
spread in the clinic. So that again came out from the this one saying there were some extraoral suctions that were marketed during that time, and
Correct.
we do take, take feedbacks from other dentists. They say that to occupy some space, there is a constant sound that is there, and it is held close to the patient's mouth. Sometimes when it is there for a very long time, there is some feeling of claustrophobia for the
Correct.
patients. So I was thinking, what else we can do?
Hmm.
So simple an umbrella shaped shaped device, which is a transparent PVC sheet. I designed it working with another engineer where we try to fit this into a high volume suction tips, which increases the diameter
Hmm.
along with the saliva ejector that is kept. If we hold this close to the mouth, there
Right.
is a thing that the aerosol spread that is splatter that is happening. If it is held across, now if I'm working on the right quadrant, if you hold it
Hmm.
on the left where it is bouncing off towards the left side, there
Correct.
is a reduction of spread. So post that you can use your disinfectants to clean the area and then you can call the next in patient. So this small device we call it as dental aerosol blocker DAB. So DAB for aerosol hygiene is what we are calling it.
Mhm.
So to reduce the cross infections that can happen through aerosols. So we came out with this product, and I had approached few pharma companies who showed some interest that did not work out. So this forum where I go, which is for business and you learn business, I
Correct.
met another fellow dentist. I showed it to her. She was really happy and she came on board. And together, she's Dr. Katyayani Priya. Uh, she and myself started this venture called 91 Danta Research and Product Development Private Limited. And she's also an entrepreneur in heart. She wants to grow big. She wants to make a difference for her life as well as others. She's ambitious. So she was in all those women network group, and which was there is something that was popping out, which was called as WSP Women Startup Program in IIM. She
Right.
wrote up to the program, and among 4,000 companies that applied, 247 of them got selected, and that one of that company is ours. So we are really
Fantastic.
happy. We are going there, we're learning how to do business, and finally they teach you how to pitch
Yes.
to investors. So there are other two verticals for this where we're thinking of skilling. So dental assistants in dental clinics are an area that is not addressed,
Yes.
and the skilling is required. If there is organization in that where we skill people from economically weaker section, they will be equipped to work in good clinics with good salaries. And
Right.
also screening. I feel very passionate about oral cancer. I took oral pathology to work in this field. So we are coming up with a risk app, oral cancer risk app called GCB risk app, Gutka Cigarette BD risk app. We're calling it like that. It's a risk app for the public to check on themselves. They're coming it in Hindi, Kannada, and English. It's a questionnaire where we're given points, and there are few confounding features where, for example, I'll say a person eats gutka for 20 years, he
Hmm.
doesn't develop any disease. A person who has done it for 5 years, he's showing changes in his oral mucosa. What is that? That is making a difference. So my dissertation topic was a similar thing where I had looked at 655 patients who had these habits. So
Wow.
I found a lot of correlation with periodontal disease and oral precancer appearing over there.
Right.
So the questionnaire is based on their diet,
Mm-hmm.
their stress levels, then their oral hygiene, oral cavity hygiene, and the amount of tobacco consumptions. That so basically, it is we want to make it a AI ML driven app in the future, where the machine learns and tells what risk the patient has. So we want to take this app in schools also, in high schools, where we ask the high school student to go towards his area and check for 100 patients of who consume tobacco and tell them, show them and fill it up in this and say that you have this risk. So by doing this, we are screening so many people, and
Yes.
also the student who's doing that, he'll never touch tobacco, and he know that ill effects that's going to happen. So we want to take up this through social sectors
Fantastic.
and do something about it. So these things inspired me to have a company that gives an outlet. So previously, what used to happen was, used to do undergraduation, post graduation, and take up an academic job.
Right.
Okay, and sometimes some academic research used to happen. But
Mm-hmm.
now, because academia has become so challenging and we don't have that many openings, these private things are will go on, because again, this necessity becomes the mother of invention. So you have to do something. Okay. So in that sense, I've opened this company, taking baby steps, and thanks to you, I'm getting a platform to talk about it.
It is fantastic, and as I said, it is very inspiring because plunging. I mean, see, I see dentistry in a different way. I think the day you graduate with a BDS degree, you are actually a natural entrepreneur, because if you have to open a clinic, it's not only about the skills that we learn in dentistry, but like patient diagnosis or whatever, but it is more about how to run that entire show. That is all about business, which we are formally not taught anywhere.
Yes.
So, and
Yes.
from that point, as you said, like innovation, it has always been there. And I think the steps that you took, it is a very bold step, because you don't come from that background, you are completely from a different background.
Yes.
And I think this ecosystem of bioentrepreneurship has been there in India for a long time, but this right now, this coming years, or I mean these years which we are living now and the future, it's government of India also puts a lot of efforts in bringing up entrepreneurship, in a very big way, and that too with which particularly like yours, which are kind of purpose driven, where you want to serve, with your innovation you are serving the society. I think it's a fantastic thing. And well, just to conclude our conversation, it is very interesting. I think we can go on, and I think in future we can connect, and I'll like to have you more on my show to speak about your experiences more as an entrepreneur. And I wish you all the best for all your endeavors. So just
Thank
to conclude, just one last question, because
you.
I
Yes.
think after people who are listening us now, or who will be watching this as a recorded version, many young minds will get inspired by seeing your journey. So in that context, what would be your message to a young aspiring dental student, or maybe a dental dentist, that for say?
Yes.
So, yeah.
Yeah. So for initial period of my time, I was a teacher. I used to teach oral pathology and DADH. So I really love working with these students, because uh, they have that curiosity or whatever in their mind or energy that they come with. So there is a lot of negativity associated with particularly saying that this profession is so much. Uh, there are so many people, and it's very difficult to excel. Blah
Mhm.
blah blah. So many things are told to their mind even before they become graduates.
Right.
They're already in that process of being biased and
Mhm.
in the notion that what's going to happen. So I also saw this small documentary on Netflix about IIT Kharagpur, and
Mhm.
I saw those students are similar to us. They are also similar to our students in dentistry.
Correct.
It is just that they're in IIT Kharagpur, they're doing their thing in that college. They also have some insufficiency. It doesn't mean all the IIT students go to Google, go to Facebook, and get that a crore of salary per annum. No, that doesn't happen. There are like 5 students who get through, and rest of them are those students like us who are there.
Absolutely.
The best part is once you graduate or once you come to the college, world is your playground. Okay, you can reach to whatever you think. So students, if at all, and the thing what happens on Instagram and Facebook, people share only what is good about their life. A person, an entrepreneur struggles. There are bad days, there are worse days. That is not put on social media. Don't take that as this person has a beautiful life and his profession is the best. Nothing. He also undergoes those bad days, but that doesn't being shared on the Instagram. So if you want to reach, do anything. Everything is possible. Everything is possible if you want to get it. And as they say, no, the world conspires so that you meet your destiny. Just be patient and be persistent. So that's the message I want to give, ma'am. Everybody are equal. Even if you're studying in AIMS or you're studying in a small college in a two-tier city, you are at the same this one, and you have that. And I feel, as ma'am said, at this time being in India and working towards your dream, it is possible. I feel.
Thank you so much, Dr. Abhishek. It was wonderful talking to you and knowing about your company and the type of work that you are trying to offer to the society. And I wish you again all the best and congratulations on your entrepreneurial endeavor, because I feel little more excited when I see particularly dentists turning entrepreneur, particularly in the field of research and coming out with their innovations to help the fellow colleagues or even the addressing a problem in the society. So thank you once again for being here. It was very nice talking to you.
Thanks for the opportunity.
Yeah, thank you everybody for joining us today, and we will wind up for today, and I'll bring another interesting episode of Eclectica very soon to you. Keep watching and subscribe my channel. Friday 8 p.m. IST, that's the time when Eclectica airs mostly. Thank you so much.